Awaken Beauties, finally, it's here. The truth to empower women to true inner beauty through a healthy mind and inner biology. I am your hostess, Cassandra Keogh, a 20-year salon owner, organic beauty product formulator, positive mind management, and clinical hypnotherapist. And I am here to help you stay sane, get sleep, and bring your sexy back. Sponsored by evoquebeauty.com. evoquebeauty.com. Now, let's get to it. Welcome to the Awaken Beauty Podcast. I am Cassandra, your neuroenergetic ADHD coach and clinical hypnotherapist, and I am so delighted to bring you to today's episode. Now, before we begin, we can all agree that there is absolutely no doubt that our fast-paced and frenetic lifestyle, coupled with a polluted environment, leaves us at the intersection of a perfect breeding ground for mental instability. Your mental health is dependent upon a highly complex ecosystem of genetics, epigenetic, cellular, and microbiome-related influences. And when it comes to supporting neurodiverse conditions, and especially ADHD, we need a radically different approach, one that gets to the root cause instead of relying solely on medication to suppress symptoms. And in this episode of the Awaken Beauty Podcast, I am honored to have Dr. Greenblatt as we open up the discussion around the benefits that functional medicine and holistic integrative approaches provide in addressing mental health and ADHD. As many of my guests probably know, my history and love for functional medicine has brought me to the conclusion that a path and answers to our healthiest future resides in always getting to the root. So before we jump into this current state of genetics and mental health and how to improve symptoms with safe, effective, and proven nutritional and lifestyle interventions, allow me to introduce you to Dr. Greenblatt. Now, as a pioneer in the field of integrative medicine, Dr. James Greenblatt has treated patients since 1988. He's an acknowledged integrative medicine expert, educator, and author, and he has lectured internationally on the scientific evidence for nutritional interventions in psychiatry and mental illness. In April of 2017, Dr. Greenblatt was introduced into the Orthomolecular Medicine Hall of Fame, and he has lectured internationally on scientific evidence for nutritional interventions in psychiatry and mental illness, and as the author of 7 books, including Finally Focused, The Breakthrough Natural Treatment for ADHD. Lastly, he is the founder of Psychiatry Redefined, an educational platform dedicated to the transformation of psychiatry, full of CE-approved courses, webinars, and fellowships for professionals about functional medicine and integrative medicine to resolve the concerns of modern mental illness today. And so with no further ado, Dr. Greenblatt, thank you so much and welcome to the Awaken Beauty Podcast.
Thank you, Cassandra. Very glad to be with you.
Awesome. Well, I had the privilege of being in your conference yesterday talking about genetics and this intersection of mental health and really where we're going in the industry, and talk about someone that has really seen the path transform and grow, and to be at the lead of that intersection and bringing this information to professionals. I'm profound thankful. I've been nerding out for probably a year and a half on your different information. And so there's a plethora. So, I think as mentioned in the introduction, we are definitely at a pivotal point right now with mental health in the world, with everything that's going on, is really kind of something that we really need to pay attention to. So as we open up, I'd just like to hear a little bit about how and where you've seen the industry back from where you started to where we're at now with the tools that we have.
I think when I finished training, it's right around the time that Prozac got approved as, the first antidepressant that was very simple and we were told very safe. So it really changed how we thought about mental illness and depression. We had a pill that could change personalities, treat depression. We stopped, a lot of the psychotherapy, and it was a pretty dramatic shift in the culture. Mm-hmm. And since the late 80s, psychiatry has just evolved into essentially a pill pushing, medicine industry, which, I kind of call mindless prescribing without a lot of thought. And as you mentioned in the introduction, with no concept of what the underlying cause is. So it's been disheartening being in the field and watching it kind of taken over by a pure psychopharm model. Doesn't mean it's necessarily good or bad, but it certainly has been, as the only model, it has really put psychiatry way behind the times in looking at a personalized medicine approach.
Yeah, I couldn't agree more. And, yesterday on the conference, it was really, really great to see how we can come at it with a functional approach, but also be able to tap into genetic testing to see the disposition and the gene markers so that if we are going to go the medicative route, that we can really match someone up so that they can really get to where they need to be sooner. So I think first and foremost, I told you a little bit about how I had really masked my ADHD quite successfully most of my career as a serial entrepreneur. That's just how I run, right? So when I started to have more complications with hormonal breakdown, kind of came through a mold incidents, everything kind of collapsed, and I hopped into a clubhouse room and I started hearing people's experiences. And only then did I latch on to, oh my gosh, I've had ADHD quite significantly most of my life, but I found how it worked for me. I've also seen studies that there are 4 times more adults being diagnosed today than there are children, which leaves me to another conclusion that this is far more than possibly ADHD, which would be just overwhelming, brains on fire, breaking down, and can't use their executive function to how they should be. So to kind of open up the conversation around environmental, genetic, epigenetic, and just microbiome influences, where and why do you see that perhaps we're having far more diagnose ADHD today?
Well, I think partly we're more aware of it, and we certainly have changed the model that, kids just outgrow it in high school and it goes away. We now understand untreated ADHD has severe consequences for employment and finances and relationships, substance abuse, and even criminal activity. So untreated ADHD is a public health problem. Car accidents probably being the most severe, 3 or 4 times the amount. So I think that has shifted, just a better awareness. But, I agree, there are many parts of consequences of health which would affect attention and sustained attention that people would consider a diagnosis of ADHD. So I think it's a combination of many environmental, nutritional factors that cause individuals to suffer from attention and poor impulse control, but also I think the fact that now people can make the diagnosis of ADHD in adults has also changed.
Yeah, absolutely. And, I think to kind of step into that, I think there's all these different things at play. And one of the things that you have so artfully been able to bring to the professional industry is really the breakdown of genetics, just to rest assured, ADHD really truly is a biological, genetic, and it is a disposition. So, the increase could be many, many factors, but, nutritionally, the microbiome, different nutritional deficiencies, specifically with kids and adults. Let's kind of tap into some of these things. And one of the things that was really highlighted to me yesterday in the conference was a lot of discussion around the COMT gene and how this has a really, really strong play on dopamine production, or lack of dopamine production, and kind of talking about the warrior or worrier gene. Could you kind of open that up a little bit and discuss the implications of that?
Sure. The COMT T gene is one of many genes that people are now talking about that affects how individuals metabolize a neurotransmitter called dopamine. And dopamine is one of the neurotransmitters that we're trying to support with ADHD to help with motivation and sustained attention. So people have different variations of this gene, and the variations affect how you metabolize dopamine. So if you have one variant called the VAL-VAL, you metabolize dopamine very quickly. And for some individuals, they're looking for dopamine. And those individuals, we have found research over many years, those individuals also do better on a stimulant medication, on the stimulant medicine we use for ADHD. Those that have very slow metabolism, called the MET variant of that COMT gene, those don't do as well, and they need much lower dosages. I think the nutritional kind of understanding of looking at these genes, because psychiatry is primarily focused on the pharmaceutical interventions. There are also kind of nutraceutical interventions, and we can support dopamine by amino acid precursors and vitamin mineral cofactors as well. So someone with a COMT VAL-VAL would do better with some of the dopamine precursor molecules as well.
Yeah. So tapping into that, looking at some of those precursors and some of the supplements are helpful to the VAL-VAL, which the other one was the MET gene. And so one of the key supplements was green tea extract and how that can slow down the COMT enzyme reduction of the dopamine. So there's green tea. Are there others that you would recommend to that corollary?
Well, I think our goal would be to support dopamine synthesis. So it'd be looking at the precursors like tyrosine and phenylalanine, the amino acids, and then the cofactors, B12 and the folate and B6 and zinc, all critical cofactors for our brains to synthesize dopamine, which makes norepinephrine. I think some of the most important things that often gets missed is that the starting point is always an amino acid, which is derived from protein in the diet.
Right.
So some of our kind of vegan individuals that might not be eating as much protein as they need can often be deficient in these precursor amino acids.
Definitely. Absolutely. I totally agree. Always diet first. And, touching upon that, there's also been a lot of talk about the MTHFR. Forms of type of B12, you'll find B12 pretty much in many supplements today, at low amounts or high amounts. I can be very sensitive to B12. I'm a very fast methylator. So what forms of, B12 are most beneficial for individuals?
For individuals that we're using injections of B12, they're very deficient. I typically would use hydroxycobalamin. And for those individuals that can take it sublingually, I often use methylcobalamin. And if someone is sensitive, you would pick that up right away, and we can switch to hydroxy or adenosine, which are, easily assimilated without that, sometimes that stimulation. The cobalamin, which is the synthetic B12 that's very inexpensive, is really not the most advantageous.
Yep, exactly. Absolutely. And then moving into a little bit more of the copper and then on the lithium conversations. I remember back when I used to do hair mineral analysis, just the importance of copper, too little or too much. Same conversation around what you've really brought to light around the conversation with lithium, too little and too much, whether it's anger or agitation with copper or lithium, same issues. And so, you have done extensive research around the levels found in water, in water fountains with children. And, there's many nutraceutical companies that sell 1 to 5 milligrams of lithium. And I really love how you kind of broke the Cinderella story open. Can you share a little bit more about these different key nutrients and supplements such as lithium, zinc, copper, seen and correlated with ADHD?
Sure. Lots of information, but to summarize, I think that the zinc deficiency, or that relationship between ADHD, has been studied for 30 years. So adding zinc to stimulants was helpful. Kids taking zinc benefiting. So we've had pretty good research over the years, but nobody really looked at why zinc would be deficient. And it seems quite clear that many of these kids have elevated copper. Copper is in the pipes, the water pipes that go to most of our homes. It's in the environment. So having elevated copper is a very, very common form of ADHD, particularly the irritable, aggressive, impulsive kids. It's easy to assess with a hair mineral test. It's easy to treat with zinc and grapeseed extract, which helps kind of bind the copper. So assessing for copper toxicity is critically important. The earlier you can do it, the more help we can provide these children. The lithium story is much longer. Lithium is a pharmaceutical, and people get scared that it's a drug and there are side effects, and absolutely we have to be cautious of the medication. But what people aren't as aware of is lithium is a natural mineral in our water supply. It's been around since the earth was formed 4+ billion years ago, and it's in tap water, and it's essential for brain function. And we don't understand all the mechanisms, but what we do understand is pretty impressive. And the literature from lab animals to human studies to supplementation studies have all demonstrated this kind of neuroprotective and neuroregenerative property of this trace mineral. I mean, it is truly amazing when you see cells of neuron cells that get healed when lithium is put in. And it's both anti-inflammatory, antioxidant. It creates all these chemicals in the brain called brain-derived neurotrophic factor that helps our brain grow. It is an essential mineral for optimal brain function.
Yeah, I loved the research specifically around the BDNF and the regenerative properties in the brain with lithium. And many of these components were made of them, and they are essential. And we definitely, because of the soil degradation and microbiome and candida, mold. I mean, there's just so many things that can really deplete us, including sugar, that just really depletes our natural systems of this. And lithium, one thing I wanted to ask you is, because there's this sensitive balance with copper or lithium, especially in mood disorders, do you believe that it's safe for someone to go on 5 milligrams or less of lithium if they have ADHD?
Yeah, we have been doing it for 30 years. And I think that the individuals that respond the best to nutritional lithium are those individuals that have symptoms of irritability and impulsivity, anger, a pure inattentive ADHD. It's 50-50. It's not as consistent. But those irritable, angry, impulsive kids that feel terrible after they kind of react to a situation, there we have found lithium to be incredibly helpful. We start off at the lower dosages, so a milligram, not 5 milligrams, because the research is getting clearer that these very tiny doses have effects, and some of the research are micrograms in the water supply that had effect on mental health and mental illness. So I'm always start recommending people start at 1 milligram, not 5 milligrams, and then titrate up to 2 milligrams if needed.
Got it. And a lot of the supplements on the market start at 5 milligrams. So I just wanted to make that note because, whether it's a tablet or a capsule, powder, or what have you, to really make sure that you start as low as possible. Correct?
Yeah, there are a few companies now that do have the 1 milligram.
Okay.
That's being much easier. Pure encapsulations has the 1 milligram now.
Awesome. And, another thing that I was curious about your opinion on, just because we are in phase 2 studies and it's really the talk of many psychiatry offices is the conversation around psychedelics and mushrooms and using low dosing and microdosing. Do you have a certain opinion on it, and where do you see that integrating into your practice? And is this something that you're interested in bringing in the future?
I don't have experience in our practice or in the hospital I work at, but I've spoken to enough patients that I've known over time where they were quite clear of the benefit. And so I do think there is a place, in psychiatry, in our toolbox for psychedelics. I do think things are getting a little overblown because, as you know, if someone is deficient in vitamin B12 or has mold toxicity, or has Lyme or trauma, we could list 100 things that you just wouldn't want to use psychedelics for.
Right.
And I think our enthusiasm is, I think, getting a little blinded both by money and the kind of sex appeal of psychedelics. And I think it's kind of going to distort the positive benefit that it could have for some individuals, particularly around chronic depression.
Yeah, I really couldn't agree with you more, especially as a clinical hypnotherapist. The amount of, and this is, I'm using this broadly, with ADHD is, before I started going down this path, I worked with a lot of individuals with general anxiety and depression and low T trauma and a lot of big T as well. But when I look back and I correlate to the clients that I worked with, many of them that had ADHD, when I first got into hypnotherapy, my hypnotherapist said that, I don't believe in ADHD. Now, I disagree with that because I absolutely can see through the genetic markers and through the experience that you've had and others and myself that it is a serious biological genetic predisposition. But I will say that when you can clean up the stuff in the basement, the traumas, the shame, the guilt, the grief of then learning that you have ADHD and being able to take agency back in your life and start to work with it, just by understanding that you're different and being able to then have something to work with is so freeing to an individual. And to take that experience away from someone of their own power and their own agency of taking care and taking a self-love and self-care approach with professional help, really is spiritual hijacking and trying to, again, fall back into even the supplement realm or the psychedelic, trying to get that path that you have so much agency to yourself. So I appreciate your position on that. And I really do agree. I think it's exciting. I think it's wonderful. I don't think that you should go and find a shaman whose name is Trina that just got, a 3-day weekend in shamanic healing and then go on a trip. But, that's up to the person.
Right.
Yeah. So awesome. So, a couple things that I think would be really important also to talk about is just the power of testing and genetic testing. There are different different tests that we can tap into. So I know that the allergy tests and what you often speak of as getting something correlated to an IgG test for allergens and food allergens. Also the oat test to measure the gut and yeast production, gut microbiome, and then also genetic testing. So can you kind of give maybe one or two areas where somebody's just starting to walk into the functional medicine world or wants to work with a practitioner, what are some of the key tests that you would say would really get someone the most data? Because a lot of these things are out of pocket that you would suggest to someone just coming across this realm.
Sure. I think some of the simple tests that most insurance companies would cover can be enlightening, and those would be things like iron, lead, magnesium, vitamin B12, folate,
Yep.
vitamin D.
Yep.
Those all can be assessed, and if you have health insurance, those would be covered. The functional medicine test, I think the hair mineral analysis is critical for both heavy metal toxicity as well as low levels of lithium, magnesium, and zinc.
Yep.
I think the organic acid is very helpful, particularly looking at the gut. I think it's important to, if possible, I look at levels of essential fatty acids and essential amino acids, often deficient, even regardless of dietary intake.
Yep.
So those provide me the biggest overview to be able to kind of support some treatment plans that are more personalized for that individual.
Yeah, absolutely. That's great. And you're right. I think you can get a lot of those biomarkers just from your regular doctor. So that's wonderful. So great. The last thing I wanted to kind of talk about was just specifically around women, and I know Dr. Felice Gersh has worked with you. She's done some seminars with your cohort. Respect her highly. She just did a piece on PCOS, I believe, with your group. But then tapping into some of the nuances around ADHD and specifically for women, like I said, they're very good at masking it, but the result of their life is very sad. I've heard quotes of 1 in 4 women will attempt suicide versus the 1 in 34 neurotypical. Like I quoted, 4 times more adults are being diagnosed than children. And so we just have a lot of different stressful components specifically for women that they deal with on top of hormonal issues. So can you share a little bit about just your experience with women and ADHD? I mean, this is hormonal. We see a lot of inference with eating disorders. There's a lot here, but if maybe you could just share a little bit about some words of hope for women with ADHD.
Sure. I mean, I think we got to go back though, because I think where we missed the boat is with young girls.
Yes.
Because the boys more often are hyperactive and impulsive, so they get noticed, even if it's for negative attention. They get called. Parents get called. They're not doing well. They have behavior problems. The women, the girls, might just have an inattention, and the impulsivity might be less. So
Right.
they often get missed in grammar school. And then some of the symptoms of ADHD might manifest itself in social relations and eating. So poor impulse control, emotional eating that can trigger eating disorders. So we know higher incidence of ADHD in both a binge eating disorder
Right.
and obesity. I mean,
Yep.
the numbers are high. So, I mean, that's where it's missed. And I think training clinicians to understand that ADHD can occur in women. The symptoms might not be as dramatic, but we have to ask the questions. And just because they're getting A's and B's doesn't mean they don't have an attention problem or struggling with ADHD.
Yeah.
And then as we get through college and young adulthood, the symptoms and sometimes the problems get magnified. And there we start to look more carefully at substance abuse, to self-medicate, at eating disorders, often also to self-medicate. Starvation is a wonderful way of treating most psychiatric illnesses. And so the women get misdiagnosed, undertreated, and then self-esteem usually is the one that gets assaulted the most, and really oftentimes is very hard to recover when we start treating young adults and adults who were not treated properly.
Yeah, absolutely. And one of the things I was chatting with a couple of my clients, and both of them, I'm telling you, have adult ADHD, and we spent a nearly 45 minutes laughing, but I mean, these are painful circumstances. But even just around, let's just talk about food prep. A lot of these women, as adults, they feel really guilty. They don't have that. They don't have that mindset where they really love to plan a meal and go get the groceries and do its timing and have this perfect dinner plan for their family. And they're looking at all these other women thinking, why can't I do that? And to just relieve them and saying, there's a dysfunction in your executive function that doesn't really give you the aptitude to planning and timing and even have any motivation to do things simple as food prep. So you eat the same things a lot of the time, which then leads into nutritional deficiencies, which, so you can kind of see the different ways that this works into just a regular lifestyle around women and health. And I thought that was really interesting. Also with sleep delay and insomnia, women not being able to turn their brain off at night, that syndrome of I have to just do one more thing because they feel a lot of pressure that they didn't get things done during the day like they should have. So they get that dopamine rush at night, which then delays their sleep. So there's just a lot of different lifestyle factors, I think, that women deal with. And then when they start to hit menopause and they really start to lose their dopamine because of lack of estrogen production, which supports dopamine, foggy brain, totally disorganized, and they just hit a wall. They go to the doctor and they get an SSRI because the doctor thinks that they're anxious or depressed, right? So I think that's just another caveat I wanted to bring in. And do you have anything that you wanted to share with that?
Well, I agree absolutely with what you've said, as so many aspects of our life have to do with organization and executive function and planning. And if those are impaired, you feel self-conscious, you don't complete what you want to, you never kind of live or work up to your potential.
Right.
And most of what I end up seeing is relationship problems.
Yeah.
Be it with the children or their spouse or their boss. And those relationship issues really can spiral to a point that can really impair functioning in many aspects of an adult's life.
Yeah. And have you found, I will say that when I started progesterone, it completely saved my life. I have not slept since I was in my 20s. And as soon as I started doing bioidenticals, it entirely changed my life. And it also helped now looking back with the ADHD and different things of that. But have you found that starting hormones for women specifically helps their ADHD?
For some women, absolutely. I think our approach is, one, making the diagnosis, and two, helping people understand that it's biologically driven.
Right.
And we're going to kind of understand what's causing it. And it could be a copper overload, or it could be hormonal. But we look at the cause and we treat it. And 10 women the same age might have 10 different kind of treatment models or programs that we would use. But absolutely, hormones would be a factor for many adult women.
Mm-hmm. Yeah, I agree. Nutritional and looking at the hormones, it's really a full approach, my friends. But when you get the right,
a lot of work.
Yep, it is.
Why some clinicians, don't have the time, energy, or training to do that broad stroke, and it's often easier to just write that script, particularly with a 15-minute follow-up that the insurance is. I've heard of 10-minute follow-ups, so you can't really assess much other than how is the stimulant helping you, and then it's the next patient.
Oh my gosh, it's so true. So, so true. And then you go into different regions of the world, the UK and India. And in some of these places, you'll have to wait 2 years to just get an appointment to even get a chance of getting a medication. So that's not great either. And I know I've heard in, India and things of that nature, even having ADHD or a mental disorder, you are so shamed by the family that you don't even dare try to get help because of the societal shame and of that person. So it's quite sad. So wonderful. Well, thank you so much, Dr. Greenblatt. I guess the last question I want to ask is just, where do you see your practice going? I know that you have such a heart for really, especially right now, getting out there and really helping physicians, coaches, professionals to really step up. I know my passion and I've asked you to create a summit with a functional medicine approach in the fall of how we can start to look at ADHD and bring all of these different groups together to start looking at the same thing, to get on the front line and test and not guess. So where do you see the industry going? Where is your driver right now? And how can we share that with our audience?
Yeah, at this point, most of my work is now shifted from, a clinical practice to an educational program. So we have professional trainings at psychiatryredefined.org, where we train therapists and doctors on a functional medicine approach. And then, the books that we've written, and we got a few more coming, the ADHD book, Finally Focused, is really for the consumer, for the patients, to try to empower, the consumer to ask for the help and to learn about nutritional influences on brain health and psychiatry.
Awesome. Wonderful. And do you have a future book coming out? What's that?
Yeah, the book that I think is really critical that we're just finishing up and hopefully be out in 2 months would be on antidepressant withdrawal syndrome. It's really millions across the globe are using medicines. Traditional psychiatry has no model of how to stop people from taking these medications, and some suffer really horrific withdrawal symptoms with no treatment program out there. So a functional medicine model has been very effective. And so that will be our latest book coming out in the fall.
Wonderful. Awesome. Well, congratulations on all your success. We truly appreciate you and the impact that you've made and will continue to make. I'll definitely be, joining your programs and look forward to speaking with you in the future. And last but not least, but I always ask my clients or my guests on the Awaken Beauty Podcast, because it is the Awaken Beauty Podcast. What have you personally, on a personal level, awakened to as of late?
I think the most important thing that I've awoken to is just how precious our health is, and the work-life balance is critical for our health and my health as well.
Absolutely. I hope you are getting balance. You are a busy man, and here it is on a Sunday, taking the time for myself and our listeners. So thank you so much, Dr. Greenblatt. I appreciate you.
Sure.
And I will be in touch, and I'll make sure we put everything in the show notes. And thank you again. And everybody, thank you for listening to the Awaken Beauty Podcast. And until next time, stay sane, get sleep, and always bring your sexy back.
Take care. Thanks.
Well, hello, Awaken Beauty. Thank you so much for joining the show today. Were you inspired? Please leave a comment or your own personal aha moment so others can capture exactly what you did. Also, please like and subscribe wherever you listen to your favorite podcasts. And if you're interested in high quality natural products for your hair, skin, and wellness, including organic CBD, please visit evokebeauty.com. Again, that is evokebeauty.com, evoqbeauty.com. And until next time, darling, stay sane, get sleep, and bring your sexy back.